Hello, everyone, and then bonjour à toutes et à tous. There have been 140,867 cases of COVID-19 in Canada, including 9,200 deaths. 87% of people have now recovered, and labs across Canada tested an average of 47,111
Okay, could I have
daily over the past week, with 1.4% testing positive. Yesterday, a total of 1,120 cases were reported across Canada. However, only 872 of these cases were newly identified yesterday. Due to a reporting backlog in Quebec, 248 of the cases are from cases identified earlier in the week. With the inclusion of these backlogged cases, an average of 849 new cases have been reported daily during the most recent 7 days. The ongoing increase in the national daily case counts is an indicator of accelerated epidemic growth. This situation increases the likelihood that we could lose the ability to keep COVID-19 cases at manageable levels. Now is the time for Canadians to redouble their efforts with personal precautions that will slow the spread of the virus. I urge everyone to consistently follow proven effective measures for controlling the spread of COVID-19, including maintaining physical distancing, hand washing, and wearing non-medical masks where appropriate. As always, the most important measure is to stay home and away from others if you are experiencing any symptoms, even if mild. By following these measures, you can keep yourself and your loved ones safer, while helping to protect people in our communities who are at high risk of severe illness due to COVID-19. Your actions can have a direct effect in reducing transmission in your community, which will help businesses, schools, and public facilities stay open. I also want to acknowledge how the last few weeks have been a time of change for many Canadians. School-aged children and their caregivers have adjusted to new routines, new teachers, and new ways of doing things. And for many, this has not been easy. Parents, caregivers, and educators are watching the increase in case numbers with concern. We can support them, as well as children and students, by following the advice of local public health authorities to help keep COVID-19 out of schools. We've come too far and lost too much to give up now. Let's reconfirm our commitment to work together and redouble our efforts to keep COVID-19 at manageable levels. Thank you.
Bonjour. Il y a eu 140 867 cas de COVID-19 au Canada, dont 9 200 décès. 87% des personnes sont maintenant rétablies. Les laboratoires du Canada ont fait l'analyse des tests de dépistage de 47 111 personnes en moyenne par jour au cours de la dernière semaine, dont 1,4% a reçu un résultat positif. Hier, un total de 1,120 cas ont été signalés au Canada. Cependant, que 872 cas ont été signalés hier. En raison d'un retard de déclaration au Québec, 248 des cas proviennent des cas dépistés plus tôt dans la semaine. Compte tenu de ces cas dont la déclaration a été retardée, une moyenne de 449 nouveaux cas ont été signalés quotidiennement au cours des 7 derniers jours. L'augmentation constante du nombre quotidien de cas à l'échelle nationale est un indicateur de l'accélération de la croissance de l'épidémie. Cette situation augmente la probabilité que nous ne puissions plus maintenir le nombre de cas de COVID-19 à un niveau gérable. Le moment est venu pour les Canadiens de redoubler d'efforts en prenant des précautions personnelles qui ralentiront la propagation du virus. On demande instamment à chacun de suivre systématiquement les mesures qui ont fait leur preuve pour contrôler la propagation de COVID-19, notamment en maintenant une distance physique, en se lavant les mains et en portant des masques non médicaux le cas échéant. Comme toujours, la mesure la plus importante est de rester à la maison et à l'écart des autres si vous présentez des symptômes, même faibles. En suivant ces mesures, vous pouvez vous protéger et protéger vos proches tout en contribuant à protéger les personnes de nos communautés qui courent un risque élevé de tomber gravement malades si elles sont atteintes de la COVID-19. Vos actions peuvent avoir un effet direct sur la réduction de de la transmission dans votre communauté, ce qui aidera les entreprises, les écoles et les installations publiques à rester ouvertes. On tient également à souligner que ces dernières semaines ont été une période de changement pour de nombreux Canadiens. Les enfants d'âge scolaire et les personnes qui s'occupent d'eux se sont adaptés à de nouvelles routines, à des nouveaux enseignants, à des nouvelles façons de faire des choses. Et pour beaucoup de gens, cela n'a pas été facile. Les parents, les personnes qui s'occupent des enfants, les éducateurs suivent avec inquiétude l'augmentation du nombre de cas. Nous pouvons les aider, ainsi que les enfants et les étudiants, en suivant les conseils des autorités locales de santé publique pour éviter que la COVID-19 ne soit transmise à l'école. Nous avons accompli trop de choses et nous en avons perdu trop aussi pour abandonner maintenant. Réitérons notre engagement à travailler ensemble et redoublons d'efforts pour maintenir le nombre de cas de COVID-19 à un niveau gérable. Merci.
Thank you, doctors. We will now open the phone line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking questions in the room, we ask that you make your way over to the freestanding mics. We'll start on the phone as usual. Operator, over to you.
Thank you. Merci. As a reminder, please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question est de Émilie Bergeron de l'agence QMI. À vous la parole.
Oui, bonjour, Dr. Njoo et Dr. Tam. La santé publique d'Ottawa dit qu'on est présentement dans la deuxième vague. À l'échelle canadienne, est-ce on peut dire qu'on est dans une deuxième vague?
C'est Dr. Njoo. Merci pour la question. Je pense en effet c'est difficile pour prononcer pour qu'est-ce qui se passe à travers tout le pays. Il y a toujours une réalité, une situation épidémiologique qui est différente, qui varie d'une région à l'autre. Ce que Dr. Etches constate, c'est selon les données et la situation épidémiologique à Ottawa, peut-être que c'est différent avec ce qui se passe actuellement, peut-être au Yukon. Donc, je pense que c'est difficile pour nous autres de déclarer en général qu'est-ce qui se passe actuellement pour tout le pays. Mais ce qu'on voit et ce qui est inquiétant, c'est qu'il y a une augmentation de cas un peu partout dans le pays. C'est sûr, il y a quelques provinces, par exemple, dans les provinces d'Atlantique, qui n'ont pas beaucoup de cas, mais dans les grandes provinces comme la Colombie-Britannique, Alberta, Ontario, Québec, on voit avec inquiétude une augmentation des cas pendant plusieurs semaines. Donc, je pense que c'était peut-être un peu trop pour déclarer c'est comme une deuxième vague, comme Dr. Etches a dit pour Ottawa, mais c'est sûr que l'augmentation, c'est une tendance qui nous inquiète.
Thank you, Doctor. And for everyone's interest, would you mind repeating that in English as well, please?
Dr. Etches has said that there's a second wave here in Ottawa, and certainly I respect what she's saying because she obviously has the information, the statistics, the data, what's happening at a local level in Ottawa. I think it's difficult for ourselves to say at a national level if we are, quote, in a second wave or, a resurgence overall in the country because the situation does differ from one area of the country to another. But what we are seeing is that certainly in the four biggest provinces, British Columbia and Alberta and Ontario and Quebec, that the case numbers have been going steadily, up and increasing for quite a number of weeks, and certainly that's concerning. But at the present time, there are parts of the country that aren't having a lot of cases, for example, in the Atlantic provinces, and so taking all that into account, it's difficult to say that overall in Canada that we are, quote, in a second wave, but certainly we're going to be following closely, and we are, I think, everyone's concerned about the ongoing increase or the, I would say, the trend is going the wrong way.
Thank you, Doctor. Émilie, question suivie?
Oui, bien sûr. Justement, je comprends qu'on ne peut pas... la situation varie d'un endroit à l'autre, mais les règles pour les rassemblements intérieure et extérieure sont différentes d'une province à l'autre. Donc, qu'est-ce qu'on peut faire pour que les gens s'y retrouvent? Par exemple, entre Ottawa et Gatineau, c'est pas la même chose. Donc, qu'est-ce qui pourrait être fait pour que les gens se retrouvent à travers différentes possibles deuxième vagues?
Oui, je pense que, merci, c'est Dr. Njoo encore, je pense que c'est très important pour tout le monde, la population générale, de vraiment suivre les consignes des autorités de santé publique locale, parce que c'est vraiment dans votre quartier, votre région, les autorités savent exactement qu'est-ce qui se passe avec la situation épidémiologique. Et s'il y a vraiment des sources, des événements ou une tendance qui on peut faire, peut prendre des mesures de plus, peut-être ajuster les mesures dans, par exemple, les bars ou des restaurants. Je sais qu'est-ce qui se passe au Québec. C'est vraiment pour les autorités à l'échelle locale. Je pense pour la population en général, ce sont les mêmes les bonnes mesures de santé publique qu'on a soulignées plusieurs fois. C'est toujours la distanciation physique, la bonne hygiène des mains, l'utilisation de couvre-visage, rester à la maison si on est malade. C'est vraiment les mêmes choses. Mais je pense qu'une autre chose, peut-être, je peux souligner, c'est intéressant parce que tout le monde, c'est toujours quelque chose un peu sensationnel. C'est dans les nouvelles. Si il y a un événement comme une grande partie, une fête à l'intérieur ou qu'est-ce qui se passe avec les bars et restaurants. Mais chose peut-être aussi très importante, c'est beaucoup de personnes atteintes avec la COVID-19, ils ont les bonnes intentions et c'est pas à cause d'une grosse partie à l'intérieur qu'ils se sont contaminés. C'est vraiment quelque chose à suivre parce que on veut pas avoir, comme on dit, la stigmatisation et discrimination des personnes. On veut vraiment encourager n'importe qui si on est malade ou peut-être on inquiète, peut-être on est atteint avec la COVID-19, peut-être on est identifié comme un contact. C'est très important d'aller sans être gêné pour un test. Merci.
Merci, Doctor. Operator, next question.
Merci. Thank you. Our next question is from Christy Kirkup from the Globe and Mail. Please go ahead.
Good morning, doctors. Thank you very much for taking these questions. I know that you have been asked in recent days about the very long lineups that we're seeing in different parts of the country in order to get access to testing. I'm wondering if there is concern on the part of federal public health officials that these long lineups are going to serve as a significant deterrent for people going to get a test because it could take many hours for them to get through those lines.
Yeah, thank you for the question. And because we're not at the local level, I can't say how many spots there are in terms of the lineups. You see them on the news, but you also don't necessarily see the places where things are actually working quite rapidly. So I think just to bear that in mind. But yes, I mean, I certainly want to thank everyone who is lining up patiently to get tested. And I think we've heard, particularly from the province of Alberta and Ontario, a reminder now that we need to make sure people who have symptoms, even if you're mild, people who are actual contacts or have exposures are the ones that need to get these tests, not just if you're sort of the word well. So that's very important for making sure that the testing clinics are prioritized for those kind of groups. Of course, they are actively monitoring any outbreaks and testing contacts, even in asymptomatic in those kind of contexts. But I think we still, though, really encourage people to get tested because that's how you're going to detect the initial cases and to break the chains of transmission. What is good news? I mean, having heard about some of these lineups, we went back just to check on the capacity of the province and territories. And it's great news that the capacity is still being increased, and it is now approximately 90,000 tests that across the country provinces can do. That doesn't mean, though, at the local level, there are certain spots where there may be some logistical and other issues that they need to deal with. But that capacity is not stopping. That is still continuing to increase. And so I think that's one aspect of it. But I do think that if you do have symptoms, if you're a contact, if you got notified through an app, all of those things are very, very key reasons why you should take a bit of patience and line up as well. Thank you.
Thank you, Doctor. Christy, a follow-up question?
I'm just wondering about the stigma. I'm wondering, what extent are you worried that COVID-19 carries a stigma in Canadian society right now?
Well, I think there's been a number of sort of information sources, including a Statistics Canada survey. I think that was a cloud-based survey, but it sort of reinforces the fact that, yes, there has been stigmatization of racialized populations and different ethnic groups. Certainly the people who volunteered to respond to those surveys have signified that there's been an increase in that kind of stigma and discrimination. I think what I will urge everyone to remember is that we do know that there's differential impact and health equity impacts on certain racialized, ethnic, and socially, economically disadvantaged populations that we've seen. I mean, you've seen the Toronto sort of sub-population data. It's because many of these groups are our essential service workers, our personal support workers. People must continue to work, and they may have a higher risk of exposure. They may be living in congregate living settings where they can't manage the distancing as much as possible. And there's access to care issues as well, people in low-paying jobs. So, I think it's something that we're absolutely, as a collective in society, need to be conscious of, and that someone who tests positive, who's in these groups, should be commended for actually getting the test. And it's an important thing to do. It's a brave thing to do because it really helps the community. And we need to support people in those settings to be able to take sick leave, to be able to stay at home. But it is a very real issue that I think we need to, each one of us as individuals and community needs to reflect on. Thank you.
And thank you, Doctor. Operator, next question.
Thank you. Our next question is from Cassandra Skorsky from the Canadian Press. Please go ahead.
Hello. I guess this is for Dr. Tam. We're seeing two different responses to the case spike from Ontario and Quebec. Ontario seems to be more targeted on individual behaviors with new limits on indoor and outdoor gatherings, while Quebec will crack down on establishments. Where do you see the main gap in containment, and how do shortcomings in each area influence overall vigilance? And I'm wondering, are we at the stage now where we can no longer rely on individuals to maintain necessary precautions without mandating and active enforcement?
I think there's many different combinations of measures that we've learned, in the last months that can work, but individual behaviors are very, very important. So supporting people I think societal cohesion and making sure our populations understand how important it is to keep up with those public health measures, and that each one of us can make a difference. Every action that we make, every layer of protection we keep up with helps stop transmission, helps break chains of transmission, and that it continues to be extremely important. I know that according to different data, locally, people might institute different measures in terms of establishments or workplaces or businesses. And the idea across the country, as I discussed with chief medical officers, that they will try to be as targeted as possible, not as blanket as approach as we had to do at the beginning of the initial wave, where we knew very little about the virus. Now there's more data. If the data in a certain area of the country is showing that it is restaurants or bars or nightclubs, that's where the targeted action will take place. But everywhere across this country, the public will continue to play a massive role. And I know that there are deterrents and there are fines that some local jurisdictions are using as another measure. But that does not substitute for, I think, making sure, just like in the first wave, that everyone in this country stick to what is tried and true and works. The other thing is that you've seen, I think in Ontario, and back to the question about Ottawa, they've spotted 3 cities or 3 regions where things in terms of rates of cases have gone up. And they've now reduced the size of gatherings, for example. I believe, and you should check it with Ontario, but I believe that also applies to indoor and outdoor gatherings. So they are trying to titrate their public health measures to where the hotspots are. So you're going to see more of those tailored approaches. But yeah, people are going to try both. They're going to try to look at reinforcing certain policies, but we can never let go of improving, enhancing, and supporting the general public in playing their part. Thank you.
Yeah, it's Dr. Njoo. Maybe I'll just add a point to that. I think that we made the point previously at press conferences is that there's certainly things that governments can do, both at a local level, provincial level, and so on, in terms of be it regulations and enforcement and so on. But at the end of the day, it really does come down to a sense of personal responsibility. Every Canadian knows what to do, I would hope now, in terms of the measures they can undertake themselves. And so it's just a matter of us maybe looking in the mirror and seeing what it is that we could or should be doing in our daily lives, who we interact with, how we conduct our day-to-day activities. And I think that's how we're going to beat this virus. Thank you.
Thank you, doctors. Cassandra, follow-up?
Yes. The U.S. recently released its distribution plans for the day a safe and effective COVID vaccine is available, including assurances would be free and that priority groups would get it first, and mention of, I think there was also mention of need for special distribution chain to handle, refrigeration or freezing. So what is Canada's plan and what guidance is being prepared for vaccine distribution?
Yeah, Canada has very, very comprehensive approaches to the whole vaccine implementation. And you're going to see us communicate that as the weeks go by. But we are, getting ourselves ready for if the phase 3 clinical trials yield good results in terms of the safety and the effectiveness of the vaccine. So some of the preparations underway includes working with the provinces and territories. We already have well-established mechanisms for all vaccines in general, but this is bigger and more challenging than any vaccine program we may have to roll out. So working very closely with them because they're the ones deploying the vaccine and the program. We're also leveraging the National Advisory Committee on Immunization. That is a committee of experts that will advise based on the data of the epidemiology of what we will see in terms of the data available from the clinical trials. But we're already working on, different scenarios, but definitely looking at priority groups in terms of, certainly people who might be at high risk, people who may transmit to those at high risk, et cetera. So all of that work is underway. And there'll be more to come. The Vaccine Task Force, of course, is involved with advice on the products and the acquisition. We are also enhancing, strengthening, looking at all of our vaccine safety monitoring, surveillance systems, our researchers who can, supplement the whatever the manufacturers have in but the post-marketing surveillance of vaccine effectiveness, uptake, and safety. So all of those things are underway, but it is, you will see more communication to come. There's more engagements to come. But I think the bottom line, though, is that you have to see what some of those vaccine clinical trial data is like. And anything that we potentially put out will be interim until we can readjust yet again with the data that is made available. And we are also looking at vaccine supplies, be it needles, syringes, and vials, and all those things being queued up so that we can be ready.
Thank you, Doctor. We will now turn over to the room. First question in the room. Let's start with the CBC News.
Hi. This question is for Dr. Tam. I'm just wondering if you can, David Thornton, CBC News. I wonder if you could walk us through what special actions have been taken this year that's different from other years to ensure that not only that there's enough supply of the influenza vaccine, the flu vaccine, but also that it will get to as many people as possible, because one would imagine the system right now is very consumed with addressing COVID-19, and you could have as much vaccine as you want, but if you don't have people to administer it, if you don't have the infrastructure to do it safely, that would be an issue.
Yes, so certainly we have annual experiences with implementing a influenza immunization program. And, the provinces and the local level have a lot of experience with that. But you're right in that the public health system is quite tapped out in terms of responding to COVID, but they've also lined up the additional resources required to deliver an influenza program. And through PSPC and with the provinces, more than usual amounts of flu vaccine have been ordered, with the ability to tap into some more if we needed. So that is a bigger supply than we normally have. I'm just trying to remember the numbers now. I think it's around 14 million doses, which is bigger than what we had before, with some contingencies to get some more if we needed to. The federal government also is putting an additional support to get the high-dose flu vaccine to all long-term care facilities. Last year, not every province takes advantage of the high-dose flu vaccine, so just to sort of level the playing field and make sure our seniors are protected. And because we know that's where the pressure points are for COVID cases as well, we want to make sure, we protect our seniors. So actual federal purchasing and support for long-term care. But we also, together with provincial jurisdictions, know it's actually a really good rehearsal for, actually putting out the mass immunization programs we may need to do for the COVID-19 vaccine. So everyone is looking at this as a good approach so that we can iron out anything else that we need to do from an implementation perspective. We've provided guidance at the federal level to how to run an influenza immunization clinic, for example, safely in the time of COVID as well. So those are just some of the key measures. We haven't had any issues in terms of delays, but, we watch that really carefully because it's a biological product and every year there could be changes. But as far as we know, that pipeline is going as it should.
Thank you, Dr. David. Follow up?
And this question is for you, Dr. Tam, and Dr. Njoo, if you want to weigh in. We've just learned that Bloc Québécois leader Yves-François Blanchet has tested positive for COVID-19. I'm wondering, given that Parliament is returning next week, what advice would you offer to MPs, especially when there seems to be some reluctance around virtual voting?
So I think, we provide public health guidance, but just like any other workplace or business, detailed plans need to be in place to ensure all of those public measures, the physical distancing, the hand hygiene, the mask wearing. You've seen what's happening around, the West Block here where we're doing this press conference. There should be options for people to be able to work remotely where appropriate. I don't know how the voting works, quite frankly, but, obviously reducing the amount of interactions and maintaining physical distance continues to be a recommended public health measure. And so I think the key is to make sure there are plans and people understand what to do if they are physically in the same spot.
Thank you, Doctor. Next question, Global News.
It's Michael Couture with Global National. For Dr. Tam, I wanted to ask you, it's been 6 months since we saw the devastating outbreaks in long-term care facilities. Besides those interim guidelines that were released around Easter saying that, among other things, workers could no longer work at multiple facilities, what concretely has been done to prevent another round of massive deaths at long-term care facilities?
So, of course, long-term care facilities they're homes to seniors and people who need a certain level of care. And it's a complex environment, but it is managed by the provinces, but also some might be private sector. So working with that sector has been really critical to enforce, infection prevention control measures. So while we provide guidelines, it's very important for each of those institutions and working, whether they're in the public or private sector, to make sure the infection control measures from the screening of, people who go into the facilities, the ability to physical distance as needed, and be able to provide the kind of sanitation, hand hygiene, and other measures. I think the other aspects is, looking at the physical environment. We know that some of the cases are transmitted because it's very difficult to spot symptoms in certain populations. So have very low thresholds for testing. And anytime there's a case, test broadly and widely, including asymptomatic and people with any kind of vague symptoms, is one way of immediately stopping those outbreaks. And supporting the workers, you've just talked about that in terms of not just, it's really supporting low-wage workers who have to, take sick leave, and all of that is really important because we depend on low wage, as I said, often racialized women in particular. That's really critical to support long-term care facilities. Without them and without supporting them, you could get increased spread, but you could also run out of health workers to properly look after our elders. And so, I think the federal government primarily has been providing, I think, financial support, but it is up to individual institutions, etc. I have heard, if you go around the country, there's different measures being put in place, but I certainly remain concerned that probably not enough is being done in every facility, and every single of these homes need to really shore up their measures. I think what I have seen, though, and we need to watch this really carefully, is right now we're seeing a rise in cases. They've generally been younger population. We're watching to see if there's any increase in outbreak in long-term care. So far, there are some, and then they continue. But in general, the number of persons in each of those outbreaks has been much smaller than what they've been in the initial wave. So I think that's a good sign, but it's not a sign for complacency. So it tells me that people are acting fast and making sure those outbreaks don't grow rapidly, but take really good care of those populations.
Thank you. Follow up.
So I hear your concern, and I understand that the federal government may be limited in what it can do and impose on provinces. But what do you say to families who maybe have a loved one or a parent inside a long-term care facility, saw what happened in the spring, worry, now hearing your concern, are more deaths just inevitable this fall, and that we'll see a repeat because people are probably wondering whether or not they should pull their loved one out of the facility?
Well, I think, as I said, that everyone has learned a lot from that initial wave. And as we all know, much of the outbreaks and the deaths occurred in the two largest provinces. And so I think that it is not inevitable. It is, I think, with all of those measures, we should be able to keep seniors safe. But it does mean a concerted effort on everyone's part. The other thing to balance in speaking with my colleagues in the province territories, they also want to make sure that we balance out the impact of families being able to visit safely, the mental health, isolation of the seniors. So I've heard of some innovation in how provinces are creating safe spaces for families to meet their all their relatives in as safe a manner as possible in these facilities. So really check out where the specific institutions as to what measures they put in place. But, with the increase in testing, with all the different measures that we've learned that works to prevent outbreaks, I'm asking for people not to be complacent, but we know what works. And I do have, I think that people should be able to prevent these outbreaks. And they are smaller, as I've said, any of those outbreaks. So we just need to keep at it and keep strengthening, those measures. And with that, I think we could see a much, much better outcome than what we had in the first wave.
Yeah, it's Dr. Maybe I just would add to that. With all the things we've learned, I think two very important things have also, obviously become much more, known by everyone in terms of the science, and that is the role of, I would call it the asymptomatic transmission, as well as also the role of, we'll call it droplets, microdroplets, aerosols, and so on. And so certainly now everyone here, the use of face coverings and so on is well understood and appreciated, where it wasn't at the very beginning, because the science just wasn't there. We treated, I think, COVID-19, we thought it was similar to other, quote, respiratory infections like influenza. So with that, and of course also with the, I think, the more stringent measures put in place by institutions in terms of screening visitors, the hand hygiene, all the protocols, that I think serves us in good stead in terms of preventing a similar situation this winter as what occurred last spring.
Thank you, doctors. Next question, CTV.
Hi, doctors. Mackenzie Gray from CTV News. In your opening remarks, you both said that essentially if the numbers don't improve right now, and as a quote, we could lose the ability to keep COVID at manageable levels. For both of you, what is a manageable level of COVID in this country?
So you have to balance the ability to detect and break those chains of transmission. So it depends on local public health capacity. So if you can imagine a single case, if you don't keep your contacts low, local public health may have to manage 50 contacts and try and find them, etc. So, the manageable means that everybody can do something right now to keep that in check. I've seen provinces hiring more contact tracers, as I said, increasing their testing capacity, but there's a finite sort of limit to that capacity. If the public does not assist with that, then you could lose that ability to do those rapid testing and contact tracing. And so those are the kind of indicators we'll be watching for, not just, cases going up and the fact that they're increasing, but we want to see that it doesn't continue and that it begins to sort of level off. If that doesn't happen, it tells us not just how virus is being transmitted, but it may give us a signal that there's the limit to the coping mechanism. At the moment, the cross-country checkup, as it were, is that people are managing, but it doesn't take much for people to be in these big settings for local public health to have to expend a huge amount of resources to do all those contact tracing. So it is not a straightforward single answer. It is actually quite different in different areas of the country. What the federal government is trying to do is that we may have to send into the rapid response mechanisms for specific spots if they're not coping. But so everything is being done to keep it at the manageable levels. The other indicators to really watch out for is the hospitalizations in the ICU. Those are low at the moment. But again, if there's any signals that things are increasing, it's another indicator that we might be going in the wrong direction. So really, though, from what I've seen at the national level, is that if we do something if everybody does what we know to be tried and true measures, this thing can, again, be turned around in terms of a de-escalation.
Thank you, Doctor. Follow-up? Oh, Dr. Njoo?
You want to add anything on Dr. Njoo?
No, not much to add. I think what Dr. Tam is saying is that there are sort of two related systems, you could say, in my mind anyway, the public health system and the healthcare system, and they're both very interconnected. So from a public health perspective, certainly we want to make sure that that system isn't overloaded in terms of the contact tracing, unlinked chains of transmission. So everyone needs to do their part, because if we start losing control and just widespread sort of unknown ongoing chains of transmission and the numbers keep going up, hopefully not exponentially, that is a concern. And then, of course, related to that is sort of the health impacts in terms of, if you get more individuals ending up with severe symptoms and having to be hospitalized and ending up in the ICU, that's another, obviously, a serious consequence that we're trying to avoid. So I think between the public health system doing what they need to do and also preventing overloading of the healthcare system, that's what we're looking out for.
The general approach that both of you have taken and seemingly most of the provinces have taken is to essentially, after we dealt with the first wave, relax restrictions and then basically ask Canadians nicely to follow the rules. We've now seen that many groups of people, generally younger people, have not been following the rules, and that in some provinces we've allowed gatherings, in Ontario recently up to 100 outside, that would allow people to be in large groups, which would mean we'd have these larger transmission events. If the asking nicely is not working as it is not now, does that not mean that we then need to go the harder route, which is what we used the first time in the first wave, to have more strict regulations, to lock things down further, to avoid getting to a situation where we overload the healthcare system or get into an unmanageable situation like you were referring to before?
Well, I think there's a broad range of measures that public health at the different levels can take. I still strongly believe that getting the public empowered to do what they need to do is still absolutely vital. And the young people, I was reading about London Middlesex and Western University. Now, these highly intelligent young people, they, go out and socialize and in different ways resulted in a cluster. But you can learn from that, and that, I think that age group can innovate and still, learn to live with COVID-19 in safer ways, but not shut down that sort of environment and the ability for them to have to learn in the, higher education setting. So I still firmly believe that a cohesive society and the public is very important. However, local public health and certainly the province have, as you've seen, and I've been told by my colleagues that they want to keep that balance. They don't want to, go back to really restrictive measures as much as they can, but they will do it if they have to. But the difference, I think, between the first wave and the next resurgence is that we want to be as targeted as surgical as possible. So not sort of blanketing the whole province, but perhaps looking at more local realities and seeing if more of these, restrictive measures need to be reenacted. But everybody's trying hard to not go there, but it is something that can happen. But the more everybody plays their part, the less likelihood it is that we're going to have to go back to restrictive measures. But the concept is that there shouldn't be, blanket approaches as much as possible.
Thank you, doctors. We have time for one more question. We'll turn back to the phone. Opérateur.
Merci. La prochaine question est de Lina Dib de la Presse canadienne. À vous la parole.
Oui, bonjour. Je voudrais revenir sur l'histoire de la seconde vague à Ottawa. Maintenant que la ville considère que, les autorités de la santé publique dans la ville d'Ottawa considèrent qu'on est en seconde vague et que le Parlement est situé à Ottawa, j'aimerais entendre votre opinion d'un point de vue de santé publique, sur l'idée que 338 députés et leur staff vont faire des allers-retours d'où ils sont vers une ville qui est en seconde vague. J'aimerais avoir votre évaluation du risque.
OK, merci. C'est Dr. Njoo. Merci pour la question. Ça, c'est une bonne question. Je pense que c'est sûr que le médecin hygiéniste en chef de la ville d'Ottawa, Dr. Etches, est responsable pour tout le comité, les résidents, les citoyens qui sont résidents ici dans la ville, à la ville d'Ottawa. Et si on parle des députés du Parlement, d'après moi, ils sont aussi comme des résidents de la ville. Donc, si les députés font des activités à l'extérieur du Parlement, je pense que comme tous les autres résidents dans la ville, c'est important de respecter les consignes des autorités de santé publique d'Ottawa, de distanciation physique, porte de couvre-visage, tout ça, etc. Mais quand on considère qu'est-ce qu'il faut faire pour travailler dans le contexte du Parlement, c'est plus une question pour, je ne sais pas peut-être en français, occupational health, c'est vraiment pour la santé des autorités qui sont responsables pour comment ça fonctionne le Parlement. Donc, les autorités, les spécialistes dans ce domaine, ils connaissent les mêmes mesures de santé publique et c'est vraiment à eux de faire leur évaluation des risques et aussi gestion des risques pour faire des recommandations pour les députés, comment travailler dans un milieu ici, au Parlement, dans un contexte pour assurer la sécurité et la santé des députés et aussi l'autre personnel dans le contexte du Parlement.
D'accord. Moi...
just answer a question.
Juste un instant, Lina, on va répéter en anglais.
D'accord.
It's interesting. The question was about what advice we would have for parliamentarians, MPs here. Obviously, because they're in the city of Ottawa, they work in the city of Ottawa, or at least Parliament's in the city of Ottawa, and the Chief Medical Officer of Health for Ottawa, Dr. Etches, has declared that Ottawa certainly is a hotspot, even as she says, in a second wave. My first reaction, thought is that certainly for MPs, when they're outside of the business of Parliament and they're actually, carrying on their daily activities outside of Parliament, they're just like any other resident of Ottawa, and they should certainly respect all of the public health measures with respect to social gatherings, if they go to a bar or restaurant, good hand hygiene, physical distancing, face coverings, all that should certainly be in play. When it comes to how Parliament itself functions, certainly I would leave that to sort of the experts in occupational health and safety in terms of what could or should be done within the context of Parliament. They certainly appreciate all of the tried and true public health measures, but how that's operationalized, how that's sort of undertaken in terms of the management of risk within the context of Parliament, both for the MPs, but also for obviously their staff. That's something within the sort of the workings of Parliament that needs to be worked out to safeguard the health and safety of everyone.
Thank you, Doctor. Lina, question de suivi?
Oui, alors peut-être ma première question n'était pas claire. Je vous demandais pas quels conseils vous leur donnez à eux pour leur travail ici. Je vous demandais d'évaluer le risque pour le reste du pays, étant donné que ce sont des gens qui font des allers-retours vers une ville où il y a une seconde vague et ils vont et viennent à chaque semaine, normalement, ou peut-être à chaque 2 semaines. Je vous demande d'évaluer le risque pour le reste du pays d'aller constamment en visite dans une ville qui vient de se déclarer en seconde vague de pandémie.
Merci pour la question. Ça, c'est peut-être un peu difficile à répondre parce que le contexte, c'est différent pour peut-être si on parle de chaque député individuellement parce que je pense que si tous les députés suivent toutes les consignes de santé publique, c'est comme tout le monde, mais c'est sûr que les voyages, si ils font des allers-retours partout dans le pays, il y a un certain niveau de risque. On sait que même prendre les vols, il y a certainement une évaluation, une bonne gestion de risque. Qu'est-ce qu'on fait avant le vol? Qu'est-ce qui se passe dans les vols avec le couvre-visage? Tout ça, c'est quelque chose. Je pense que les députés maintenant sont sensibilisés. Je pense que quand ils sont dans leur conscription, c'est aussi important. Je pense que tout le monde comprend qu'il faut limiter, comme dit, peut-être les interactions, pas faire comme auparavant, se serrer les mains avec tout le monde, tous les personnes dans leur conscription. C'est sûr que le job d'un député, c'est vraiment de discuter, engager avec la population de leur conscription, mais je pense que s'ils aussi suivent les consignes de santé publique dans leur conscription pour assurer la santé et sécurité de tout le monde, et faire même chose ici à Ottawa, que oui, c'est bon pour gérer le risque, mais en fin de compte, c'est pas vraiment pour moi. Je pense que tout le monde doit faire une auto-évaluation de leur risque et peut-être pour quelques-uns, c'est vraiment avec le voyage à distance, tout ça, peut-être c'est mieux, travailler virtuellement ou peut-être rester ici à Ottawa. C'est quelque chose, c'est vraiment, il faut avoir des discussions, je pense, au sein des partis individuellement, mais aussi avec les experts ici de santé publique.
Est-ce qu'on peut répéter en anglais pour une autre fois?
Okay, the question was about what I think about the risk of MPs going back and forth. That's a hard one because certainly it might even come down to sort of an individual sort of assessment of risk for MPs, depending on, where they come from, where they work. I'm just adding on to my answer in French, depending where their riding is, who knows what the activity, COVID-19 is compared to what it is in Ottawa. I think everyone's very sensitized that certainly you need to follow very, I think, scrupulously, if I can use that word, the measures for public health, both while you're in Ottawa, for anyone, but obviously for the MPs. Then also, if there is this back and forth travel, to also follow very strictly what is recommended in their local riding. I think all MPs certainly understand the work of MPs. It is to engage with obviously their constituents, to, as they say, press the flesh and so on. That was before, and I think now people recognize, and MPs, from what I understand, are not going around sort of shaking hands with everyone and having large meetings and so on. So I think their business has changed. But I certainly think also it's an option that it should be discussed both within parties but also with the occupational health experts. For an individual MP, maybe with their own risk assessment and other considerations, maybe there might be the option of working maybe virtually or maybe even staying virtually from their riding or maybe working here in Ottawa. But that's not really for me to decide. All those things need to be part of a sort of a fulsome evaluation. Thank you.
Thank you, Doctor. C'est ce qui m'a fait à la conférence de presse. That will be all for today's press conference. Thank you.
Thank you. Merci.